Hello, my name is Divyam Mishra, KD0OOE, and in this video, I'm going to tell you about what a defibrillator is and how to use one in an emergency situation. A defibrillator is a device that checks the heart fibrillation of a patient's heart. They're commonly located in public locations, such as libraries or rec centers. In these locations, they're usually mounted on the walls or hidden under desks. Defibrillators are used in emergency situations, like a cardiac arrest, involving a patient's heart rate or beating fluctuating rapidly and not normally. Sometimes other signs and symptoms precede sudden cardiac arrests. These may include fatigue, fainting, blackouts, dizziness, chest pain, shortness of breath, weakness, palpitations, or vomiting. But a sudden cardiac arrest often occurs with no warning. Stop! If you see a patient with signs of a sudden cardiac arrest, please do not run around trying to find a nearby defibrillator. First call 911 and please be prepared with information such as your name, location, and a short summary of the situation. Then try to locate the nearest defibrillator. Hello there again, and here's the defibrillator. The three main parts in this device are the three buttons you see here to the right. The first button, which is the ready to go green button, powers on the device in the first place. Then we have the information blue button, in which on the way delivers additional information to you. Then you see this orange flashing orange button, which tells you a shock is advised. And when you press this button, a shock will be delivered. Then you have these latches. This latch, which says pull, in which when you pull, pads are accessible, in which then you put the pads on the patient's chest. So suppose this is a real-life situation in which a patient is going through a sudden cardiac arrest. First, we open the defibrillator by unlatching this latch so that we can get the pads and put them on the patient.
Begin by removing all clothing from the patient's chest. Cut clothing if needed.
So suppose I have the clothing removed from the patient and I unpeel the pads.
Look carefully at the pictures on the white adhesive pads. Peel one pad from the yellow plastic liner.
Then what I do is I place the pads on the patient. So the first pad goes on the right side of the patient's chest, as shown. Then you firmly press down on the pad. Then you place the second pad, which is placed below the rib cage of the patient. Press firmly, and then the defibrillator will tell you either if a shock is advised or not. If a shock is advised, go ahead and press this flashing orange button. Okay. Suppose the same situation was applied to a child. What do we do? Well, the same steps apply at first. First, you unlatch the latch button so we can apply the pads to the patient.
Begin by removing all clothing from the patient's chest. Cut clothing if needed.
So suppose I remove the clothing.
Look carefully at the pictures on the white adhesive pads. Place pad exactly as shown in the press pads firmly to patient's bare skin.
So then what I do is, suppose I already ripped the clothes out of the patient. What I do with the child is first I place the pad between the chest, in the middle of the chest of the child. Then what I do is I place one pad in the center of the child's back. And the same situation applies. The defibrillator, it will either tell you if a shock is advised or not. Then simply press this flashing orange button for it to shock.